Welcome to the Digital Planning Podcast. This series is designed to educate individuals about all things digital in connection with estate planning, business planning, and estate administration. To keep up with all things digital, please subscribe at iTunes, Stitcher, Google Play, or wherever you download your podcasts. And now, Jennifer Ziegel, a partner at Kleinbart LLC, Ross Bruck, a principal of Estate Genie, and Justin Brown, a partner at Pepper Hamilton LLP, with today's topic.
Thank you for joining us for this episode of the Digital Planning Podcast. I'm your host, Ross, with my co-hosts, Jen and Justin, and today we're going to continue our conversation with Dr. Gupta.
So, Atul, one of the things that I do in my practice is I draft powers of attorney and healthcare powers of attorney for clients. And from my perspective, I kind of draft them and I don't always see what happens to the medical powers of attorney. Have you ever, in your practice, ever confronted these medical powers of attorneys? And from a technology perspective, do you see these documents changing, or the impact of these documents, or the use of these documents changing down the road?
Yeah, it's a very good question. So yes, on a daily basis, every physician, particularly interventional radiologist, deals with some element of the power of attorney. And I'll lump it all together, including with the informed consent process, because we have the power of attorney when we can't get informed consent from the patient because either they're incapacitated, debilitated, they're on certain drugs, and so on, medications. So yes, and every hospital has their way of doing it, but we know who the power of attorney is if the patient is not consentable, and then we make great efforts to try to contact that power of attorney. But it also is a bit of a struggle because the rules continue to get more and more strict, so it has to be the physician performing the procedure that gets the consent. So if that physician is already doing a procedure and you're now trying to get a hold of a family member that could be in another country even, but they're listed as a power of attorney, it's just this game of phone tag. On top of that, there are language barriers. I remember very distinctly, especially in a city like Philadelphia, we have a lot of diversity in terms of languages. I had a patient that spoke Burmese. I had to get consent from them. I had to get consent from their power of attorney, actually, who also only spoke Burmese. You can't just use a family member to be the translator in this process because it needs to be somebody independent. So we go through things like AT&T language lines, and we have interpreter services, but there wasn't anybody that was available to speak in Burmese. So this is now, it does turn into a challenge, especially with emergencies, but I think technology may be able to help with it. So there's a very interesting thing that's happening with informed consent at the University of Virginia, actually. They're using augmented reality to help with this, because right now we explain verbally what the risks and the benefits and the alternatives of the procedure are, either to the patient or their family member, their power of attorney. But if we can give them a movie, or maybe even bring them into the world of what that procedure is going to be like from the time they get wheeled out of their hospital bed to the procedure room and back, it makes it much more understandable to them for what they or their family member is going to be having. And then we can even document that whole process visually. And so the University of Virginia is one of many places that's experimenting using digital technology to ease this power of attorney process and the consent process.
So what does that look like? Is that more of you put a movie in front of the individual so they can watch exactly on screen what's happening and see the whole procedure on the TV?
Yes, that's one way of doing it. Or if you put a physical headset on the person, they can actually feel immersed in the environment as if they're really there, and they can look around and they actually feel like they are in the procedure room, or they feel like they're on their way to the procedure room.
A virtual reality.
A virtual reality.
And do those videos demonstrate what could happen if the procedure goes awry, or if there are complications that develop?
In this process, that's what UVA and other places are trying to figure out now, is how much information do we give, how much is too much, what is it that we need to show? And but for sure I think you need to show the alternatives, the risks, the benefits, in a non-scary way, but certainly in an honest way.
So you mentioned augmented reality. Could you tell us about that a little bit more in depth?
So AR or VR, most people actually already use it. If you watch, for instance, tennis matches or football games, you're watching the real world, but then you see superimposed data on, for instance, the football field. You'll see lines showing how many yards they need to go. That's augmented reality. If you use a mobile phone or a tablet, maybe you're putting virtual furniture in your house, and you can put a chair from a furniture company and see if it fits and if it's the right color, superimposing it on the real world. Where kids are using Snapchat, and they can take pictures of one another and have, kitten masks on their face virtually. That's augmented reality. So all of us are actually familiar with augmented reality, but AR in health takes that to the next level. So what we want to do during a procedure, what we do today is all the people involved in the procedure are looking at different screens of data, sometimes up to 16 different data sources. And we're finding that people aren't paying attention to the patient. And having to process all of this data is very difficult. And so it's kind of like the medical equivalent of an airplane cockpit. And the way I like to describe it is when you're driving a car, you want to keep both of your hands on the steering wheel and keep your eyes on the road. And you don't want to constantly take your hands off the steering wheel to move buttons and to look at information. And that's what we have to do today in these operating rooms and procedure rooms using all of this digital data. And so augmented reality now lets us do something quite different. It lets me keep my hands on my instruments and my eyes on the patient, because wearing a goggles or a headset, I can now superimpose digital data on top of the real world. And in fact, everybody in the procedure room has their own personalized display of data that they need. And it changes during the course of the procedure. But it's not just visualizing data, it's also controlling the system. So we can also control, for instance, the Philips equipment by giving voice commands or using sophisticated gestures, touching fake buttons. Even eye control, eye tracking. I can look at a button and select it just by looking at it. And so this is what we have been working on, quite secretly actually, with Microsoft earlier this year. So this year at the Mobile World Congress in Barcelona, back in February, Microsoft announced to the world the release of, or the soon-to-be released HoloLens 2. That's their headset, their platform, their goggles. And at their keynote, I was there, and their CEO, Satya Nadella, he closed the global keynote with how they're working with Philips, a leading health tech company, to use that technology in the world of operating rooms. And so we're very excited to see where this goes. It's still a work in progress, but it's going to completely change the way we do procedures.
When do you think that technology will actually be able to be implemented into operating rooms?
So the regulatory process is pretty strict in healthcare. We are already done phantom testing and animal testing. We've shown this technology to already 300 physicians around the world to get feedback on things like what exactly is the right way to touch a virtual button? How much data is too much? Where do you want the displays? What does a 3D hologram do in terms of whether or not you're getting dizzy and things like that? So we're going to do our first in human testing probably next year, but we're moving very fast.
You mentioned before about how Philips will sometimes bring, for example, teenagers into the operating room to get their thoughts on medical operations. Does Philips also take a look at what patients think about medical data, about healthcare innovation, about technology?
Yeah, great question, Ross. We do this in a very big way. So every year, Philips does a study called the Future Health Index. And it's an independent study that we commissioned to basically answer just what you just said. What are patients thinking about big healthcare topics? So this year in 2019, we did the Future Health Index on digital health technology and digital data. And so what that means is that we asked 15,000 patients around the world, and by the way, also 3,000 healthcare providers around the world, so doctors and nurses, all sorts of questions around healthcare and digital health technology. And we did that in 15 different countries. And so we got a lot of interesting insights. So for instance, we know that 2/3 of all the patients that we've queried want access to their own data. They want to see their own medical data. And I happen to believe that data empowers a patient. I like it when patients know their own medical data. Interestingly, actually 21% of patients did not want to see their own healthcare data. And I also kind of think that that's somewhat interesting. Now, if you look at the people that have access to their own data around the world, when you ask them how good is your quality of care, by far people that have their own data feel that their care that they're getting is much, much better. And of course, it's also not surprising that when you ask people that are 18 to 34, the young generation, they really want access to their data, and the older people may not be as interested. So that's one way we look at it. And there's also some interesting geographic insights. So I don't know if any of you know, if you had to guess what country might have the highest adoption of physicians using digital healthcare data, can you imagine on the planet what countries are really good at having physicians use digital healthcare data?
I'm going to guess UK.
So it's an interesting question, interesting answer. Wrong. Actually,
Israel?
Israel is actually high up on the list, but the 3 highest countries that we studied were China, Saudi Arabia, and India have some of the highest adoption of physicians using digital data. And actually, the 2 countries that were below the world average were the UK and the US. So we're lagging behind in the United States on actual use of digital data. Now, I think maybe some of it's related to the interoperability that we discussed before, and also things around cybersecurity, privacy, data concerns, because after all, your medical data is 10 times more valuable than your financial or your credit card data. In your profession and societies and governments are now struggling with who owns the data, how do we secure the data, and how do we best use the data in a conscientious and a responsible way.
A moment ago, you mentioned that 21% of people reported that they don't want access to their own data. Would you care to give a theory as to why you think that is? That's a really interesting statistic.
It's just a theory, but a lot of times it goes back to even the informed consent and power of attorney process. A lot of times, particularly older individuals, they don't want to hear about what are the risks and benefits of the procedure. They just want you to take care of them and don't tell me what I have to deal with. They don't want to know. They grew up in an environment where they, I think, just trusted hospitals and doctors, and you fix it, and the less I know, the better. I sense that it's that crowd that doesn't want access to their own data, but the 18 to 34-year-olds sure do.
Justin and Jen, I think that speaks to drafting power of attorney documents for different generations. You might look at a document differently for an older individual who might not want as much or care as much about access to data, medical data, as a younger individual might. So it might influence the way things are drafted in the near and long term.
Yeah, I agree. I think what I've seen in my practice is older clients typically may not be aware of the data that they have access to, the digital data that they have access to, and they're not thinking of the possible permutations of who can access and what the consequences of accessing it are. Whereas younger individuals, it is top on their mind of who's going to be accessing all of this information.
I completely agree. And just mechanisms in place so that they can control the access to that data, within their own hospital physicians group and outside that if they want to expand.
So speaking of access, one of the questions I have is wearables. And who has access to that information?
Well, there's all sorts of wearables. There's consumer wearables like smartwatches, health watches, and then there's hospital wearables like the early warning system I described to you earlier. It's a little bit easier when you're talking about the hospital because they're kind of walled off environments where that information oftentimes doesn't go outside the walls of the hospital. But in terms of wearables like smartwatches, it's a good question. Smartwatches, I think, have a huge potential in improving outcomes. A bit of it up till now has been a bit about hype. But for instance, if you look at some of the work that's been going on with EKG detection and detection of atrial fibrillation with a smartwatch, the reason it's important, so people understand, is that if you just get an EKG once a year in your doctor's office, well, what are the chances that you might be in atrial fibrillation, which is where you have an irregularly beating heart at that split moment in time when you have that EKG done? And the reason we care is because if you have AFib, you're at a huge risk of getting a stroke. So we want to catch you and treat you so you don't have the stroke. If you have a continuously worn device, like a smartwatch, that's always checking and recording that data and then alerting you, well, then maybe we can reduce the complications related to stroke. And in fact, there's big studies now underway to look at just that. Same thing with blood pressure. We all know white coat syndrome. If you check your blood pressure in a doctor's office, a lot of times you're nervous and your pressure is up, and then people are getting overtreated with blood pressure pills that they may not need just because they were nervous at that point in time. That's why companies like Under Armour, for instance, just filed a patent this year to put blood pressure detection in your shoes. thinking that just like a watch, maybe if I'm always checking your blood pressure as you're walking around, we can know better who needs to be treated and who doesn't.
It's like the Reebok pumps.
It's like a Reebok pump, I suppose, yeah. So what I don't have an answer to is who owns that data, and how do you make sure that it's secure, and who inherits that data afterwards.
So have you heard anything or seen anything about who does in fact inherit that data? I mean, the situation that I have not come across yet, but I'm just waiting for that to hit, is in the course of an estate administration, if we're looking for a medical information from somebody, and let's say it was located on an individual's wearable. Somebody gets in a car accident. What was their blood pressure? What was their heart condition right before? How would somebody access that information?
A very good question, and I think that actually I would turn that question around back to all of you guys, because I think you guys are going to have to solve this problem for us. I have access to data of my patients, but I don't have competency to know who should have access to that if the patient expires. And there's good and bad. So if you look, for instance, at the way flu shots are developed, or the way the CDC tracks measles, having a huge amount of anonymized data benefits society, because that's how the CDC determines where flu outbreaks are, how do we make the flu shot for this year, where the measles epidemics are occurring, and so on. And they can capture that information really quickly by effectively crowdsourcing using maybe wearables or some other kind of health technology. On the other hand, I do see that there could be risks over time if that data gets into the wrong hands. In fact, that's why many, many, many companies are now trying to get into the healthcare data space. And these are traditionally tech companies that we're all familiar with, the Apples and the Facebooks and the Googles. But hospitals are very much struggling with, and patients, who do I trust to own this most valuable commodity? Do I trust those companies, or do I trust a healthcare company to own that data? I can't speak on behalf of them, but I can speak on behalf of Philips. It's a 128-year-old company that's been in healthcare for 100 years. And 85% of hospitals in the U.S. already use Philips, so they're seen as a trusted provider. But hospitals and people need to understand who's going to own that data.
Which is fascinating to take it back to an earlier part of our conversation where we were talking about we would prefer hospitals that share information because then you can seek treatment elsewhere. For the exact same reason, maybe you'd want the hospital that doesn't share any data, and that younger people who actually care about this might seek out a hospital that prohibits the sharing of any information.
And on that point, it also could come back to what applications the person is utilizing in connection with their wearables and their smartwatches and other trackers or devices that they might have, and the terms of service agreements between the user and the application. And if there are any overlaying issues with the actual device, or if you have an iPhone and you're using an iWatch and you have some application that's being run on the iWatch to collect this data, it would be the terms of service agreement with that application's provider that I think is going to really control who would have access to the dissemination of that information at a later point in time. And with a lot of things that we've discovered with Apple products, people are going to be very surprised that they might not actually have ownership of the data or information that's being run with those applications on that type of device.
And what if you have multiple apps that are all feeding into, they say, the health app, right? So you've got different terms of service agreements for each thing, maybe something for your sleep, and maybe something for your workouts, and maybe something for your blood pressure, and they all feed into the health app, right? So you've got different terms of service agreements working together or against each other in order to access this digital data.
Exactly. It's a multi-pronged inquiry.
And Jen and Justin, you bring up the exact issue, because for this to work well, we need to have multiple sources of data, really from an end-to-end approach. And so, for instance, there is a cloud-based platform that Philips has created called Health Suite Digital Platform, and it's to do exactly what you described. Take all the information in a centralized repository, whether it be your wearable, whether it be your Sonicare toothbrush, that can track, your teeth health, whether it be your CAT scans, whether it be your blood work, whether it be your image-guided therapy procedures, and your telemedicine stuff. Basically from end to end, from healthy living and prevention to diagnosis and treatment to home care. That's what we work in at Philips. Everything we build is something in there. And if we can put it all in the cloud and then have it make it very quickly and easily accessible to your physician in an interoperable way, regardless of which hospital or which country you're in, that's how they can make really good informed decisions in a very quick way.
In terms of going back to drafting considerations for healthcare powers of attorney and medical declarations, in terms of updating these documents as this technology grows, it'd be interesting to think about or give clients the option of whether their agent could actually have medical devices put on that person. So if you have a person who is incapacitated and the doctor makes a suggestion that they should have a wearable to track, heartbeats or other metabolic functions, does the agent have true authorization to authorize the addition of some type of wearable on a patient under the power of attorney document? Because it's going to be collecting invasive information at a different level.
So as a consumer, I'm okay with the idea of strapping every wearable on me and giving as much data as possible to get a better understanding of my own health and my own statistics. But I also say that as a fairly young individual who's in fairly good health, and I can imagine that if I was not as young as I am, and if I was not as in good health as I am, and one day I won't be, I wouldn't want to share that data. So I kind of see both sides of the willingness to have information about me given to, especially, for example, an insurance company. Sometimes companies will entice consumers to act in favor of sharing information, sharing data by giving gift cards or by giving additional financial incentives. Does the group have a thought around this whole process?
Well, my question is, do people understand the consequences of, I'll say, for lack of a better term, selling their medical data for a gift card? For example, you mentioned life insurance, right? If I have a wearable and I'm giving that information to the insurance company, I may not recognize at that point in time that the insurance company's access to that data could impede my ability to get good rates on my insurance. So I wonder if there needs to be informed consent, so to speak, of the disclosure of your medical information.
Yeah, I like it as long as it's working for me. And the second it's not, then it's an entirely different equation. But when I first made that decision, when I first decided to sign up, it might be a different world that I'm living in.
And can you turn that off? Is it a continuing obligation to give that information once you've agreed to give it, or can you stop it at any point and take back your data, so to speak?
Do I have to give back my Red Lobster gift card?
Exactly.
From what I've seen, when people are using wearables that are connected to some app that an insurance company might be monitoring for, reductions of their policies or Amazon gift cards, if they do certain tasks that are under the guise of wellness, that if it could and truly have a negative impact on their lives, if they're a smoker and this information is deducted from these wearable technologies, and that their premiums do increase, or they might not be eligible for certain other benefits or programs that the insurance company might offer or sponsor because of information gathered directly from the wearable. And I think it's a slippery slope. I think it can be very dangerous if it's not more regulated. But I also think people need to be aware that this data is a commodity, and there are startups right now that have the goal of commoditizing this data directly to the user. So although they're giving this information to their health insurance company now, in a few years will they be wearing a wearable for some other startup company that they get a larger cash benefit from the collection of the data.
So, Atul, where do you see technology and digital health going in the next 5 to 7 years?
Well, if you want to get a peek at where I think health is going, you just look at your consumer world, because healthcare lags behind the consumer world significantly. So, for instance, in a hospital today, at least in the United States, we still use fax machines, we still use regular beepers. Things lag behind in healthcare, and it's unfortunate. But kids today, adults today, are very used to using things like voice recognition, Alexas and Siris, augmented reality, chatbots, AI, gamification. And so those are some of the technologies: telemedicine, telepresence, Skype, FaceTime. That's the stuff that's going to be affecting our healthcare lives within the next 5 years. Already some of this is happening. So for instance, if you want to, you can probably see a doctor for a non-acute care virtually, or a physician assistant through a telemedicine platform nowadays. A lot of places, including pharmacies, are doing this. And young people like that because it's fast to get an appointment, but there does come with downside. I think that computers aren't going to replace physicians, as I said. It's not about just the algorithm and making the diagnosis. There's still the hand-holding. Two patients are never the same. There's caring, there's compassion, and computers are never going to replace that aspect of it.
From a technology perspective, what do you think individuals need to be most aware of in this space?
I think that they should not be fearful. I think that while it feels like it's a lot of hype, a lot of this stuff is here today. I gave some examples earlier of wearables that we're using that are changing your lives already that you may not even be aware of. So it's already here. And now regulatory agencies need to catch up with the speed of the technology that's being developed. So for instance, the FDA recognizes this as a problem. They recognize that we need to get on top of how do we manage all of this digital health stuff. So they have an Office of Digital Health now at the FDA. In terms of augmented reality, I'm actually very pleased. I was invited by the FDA in March to speak about augmented reality, and we're going to have a workshop where they bring together patients and doctors and startups and industry, all of the stakeholders, to figure out how do we safely accelerate what we want to do in AR. And they're doing very similar things for all of digital health. So they are playing catch up, but at least they're playing catch up.
Any other interesting projects that you're working on that you can share with us?
Yeah, I mean, it's all about cool technology. It's one of the cool things about my job is I get to see what's coming down the pike. So whether it's AR or AI, new devices to prevent amputation or reverse stroke, ways of treating the atrial fibrillation we talked about without surgery, replacing heart valves, killing tumors. There's a procedure called TAVR, transcatheter aortic valve replacement. It used to be that you had to have big surgeries to replace your aortic valve. Now we have tools and technology to replace it, again, through incisions not much larger than a pencil point. In fact, actually, Mick Jagger, you may have heard, just had a TAVR procedure earlier this year. And it's just amazing that 70-year-old people can have these procedures performed, leave the hospital in days. He went back to touring very, very quickly. He put pictures on social media of him in the park like a week after his quote-unquote surgery. So TAVR is an amazing procedure, just one of these many image-guided procedures that are revolutionizing care. In fact, sometimes I say TAVR put the swagger back in Mick Jagger. So.
Well, do you have any final thoughts before we wrap up today?
Well, I think as we started out, we said how we were all fortunate to grow up in a time without digitalization and cell phones and PCs, and we saw that transition, and I'm fortunate enough to see that same thing in healthcare. So for me, this is the most exciting time ever in the history of healthcare, and it's all about digitalization of health. And so having this insider's view of what's coming down the pike makes me really, really excited. Hold on to your seats. It's really going to be an awesome decade.
Thank you very much, Dr. Gupta, for coming on today. How can our audience members contact you?
Social media. You can follow me on Twitter. You can follow me on LinkedIn. I'm Atul Gupta, MD.
Thank you for joining us on the Digital Planning Podcast. I hope you enjoyed our episode, and we look forward to seeing you next time.
Thank you for listening to this episode of the Digital Planning Podcast, the podcast designed to educate individuals about all things digital in connection with estate planning, business planning, and estate administration. Please subscribe to this podcast and leave us a rating or review at iTunes, Stitcher, Google Play, or wherever you download your podcasts. Thanks for joining us. We'll see you next time.